Це перевірю.
Good day, dear student. I'm docent, Department for the Propedeutics Pediatrics, Елена Gostищева, and today our first lecture, Periods of the Childhood, Their Characteristics and the Features, Newborn Child. Periods of the childhood, their characteristics and the features, newborn child. Today we will discuss about the pediatrics, the science of the healthy and sick child, newborn child, and periods of the childhood. Pediatrics, the science of healthy and sick child. Pediatrics, from the Greek paidos, child, and aitreia, treatment, was separated in independent part of the medicine in the middle of the 19th century. The child was long considered a miniature copy of the adult person, and the diseases of children differ nothing from the diseases of the adult. There were no rules for child care. Children being treated according to the same principles as adults. Pediatrics is a science that studies the patterns of the child's development and the rules of his nutrition, the etiology and pathogenesis of childhood diseases, means of their prevention, diagnosis, and treatment. Pediatrics medicine period of growth, formation, and development of all systems of children's organism, which are the most responsible in human life. Pediatric studies ways of the child's development and rules of his feeding, the causes and mechanisms of diseases, methods of the diagnostics, treatment, and ways of the prophylaxis. The basic directions of activity of the pediatrician. First, prophylactic work, second, anti-epidemic work, and the third, medical work. The pediatrician should be polite, intelligent person. His emotions never come out in the opposites with logic and hope of scientifically well-grounded decisions about sick children. Khotovitsky in the 1847 wrote that pediatrician should have special relation with children. He should treat to the children with pleasure. And I hope that some student, international student, want to be pediatrician. Periods of childhood. The reason for the division into age periods is the constant growth, development of the child, and the anatomical, physiological, functional, and biological differences in the body in different days, months, and years of life. The reason for the division into the age periods is the constant growth, development of the child, and the anatomical, physiological, functional, and psychological differences in the body in the different days, months, and years of life. First of all, we should remember about intrauterine period, from the moment of fertilization up until childbirth. And intrauterine period divide embryonic period till 12 weeks of pregnancy and fetus period from 13 weeks up to the birth. Intrauterine period from the moment of fertilization up until childbirth. Embryonic period till first 12 weeks of the pregnancy, and fetus period from 13 weeks up to the birth. Please turn attention in this slide, a very interesting slide, prenatal development, the growing fetus, fertilization, next stage, it's 30 hours, next stage 6 weeks, and the next stage it's 4 months, the growing fetus. Please turn attention about the critical periods of the development. According to the age of the fetus, very important period, very important weeks for some or another system. Embryonic growth phase is characterized by the highest rate of tissue differentiation. Its major feature is organogenesis, formation of almost all internal organs of the future child. Embryonic growth phase is characterized by the highest rate of tissue differentiation. The major features is organogenesis, formation of almost all internal organs of the future child. Placental growth phase. We say about early fetal period till 28 weeks, intensive growth and differentiation of fetal organs and system. The effects of some unfavorable factors do not constitute severe defects. However, they can slow down the development of the organs and tissue differentiation. And late fetal period after the 28 weeks before until the child's birth. Pathological factors do not affect the already formed fetal organs, but could cause early deliveries and the birth of premature babies with a low body mass. We are say about the formation embryopathy or fetopathy. If the teratogenic factors do during the pregnancy, during the first 3 months, we are say about the embryopathy. It's a crisis of development of organs. And if the teratogenic factors do the fetus during the from the 4 till 9 months, we are say about the fetopathy and the development of organs. The common diseases that appear in embryonic period, embryopathy, examples of the embryopathy, anencephalia, hydrocephalia, pilar stenosis, congenital malformation of lungs, kidney, congenital heart defect. Common diseases that appear in fetal periods, fetopathy, examples, microsomia, decreased size of some parts of the body, hypoplasia, organ or system of organs underdeveloped, microsomia, increased sizes of some parts of the body, intrauterine infections, different intrauterine infection, hepatic infection, hepatitis, rubella, toxoplasmosis, and others. Unfavorable or teratogenic factors. There are non-adequacy of fetal nutrition, acute diseases and reactivation diseases of the mother, mother's heavy physical activity, professional hazards of the mother, alcohol intake and smoking habits of the parents, bad socio-economic condition, and other. According to the classification, we are say about the next three groups. All the teratogenic factors are divided. Exogenous factors, endogenous factors, and combination of the exogenous and endogenous factors. Example of the exogenous factors: physical, chemical, biological. They are radiation, for example, physical, magnetic fields, vibration, X-ray. According to the chemical, be it ecology, the smoke, marijuana, cocaine, medicine, alcohol, biological, viral, microbe, helminths, and others. Example of the endogenous factors: mutation of the genes, chromosomal aberration, number of the structure. These are examples of the teratogenic factors: exogenous, endogenous, or combination exogenous and endogenous factors. Please turn attention in this photo, a baby with a fetal alcohol syndrome. Facial characteristics: small eye opening, smooth philtrum, thin upper lip. This is a baby with the signs of the fetal alcohol syndrome. In this case, unfavorable teratogenic factors is the alcohol. So, extrauterine period. First of all, we will say about the neonatal period or newborn period. Neonatal period lasts for the first 28 days of the infant and subdivided in two sub-periods. Early, first 7 days, the most responsible for children's adaptation to extrauterine life, and late, from the 8 till 28 days, healthy child during this period is already at the home. Neonatal period lasts for the first 28 days of the infant and subdivided in two sub-periods. Early, first 7 days, the most responsible for the children's adaptation to extrauterine life, and late, from the 8 till 28 days, healthy child during this period is already at the home. In which case we are say about the healthy newborn. Who is healthy newborn? Healthy newborn, a child who was born from the mother who did not have complications during pregnancy in the childbirth, Apgar score from the 8 till 10 points, the average weight of the body from the 3.2 till 3.6 kg, normal course of the adaptation period, maximum weight loss not more 6-8% kg is breast fat. We are say about healthy newborn, a child who was born from the mother who did not have complications during pregnancy and childbirth. Apgar score 8 till 10 points. The average weight of the body 3.2, 3.6 kg. The normal course of the adaptation period and maximum weight loss not more 8% kg is breast fat. Classification of the neonates by birth weight, by gestational age, by both gestational age and body weight. According to the gestational age, we are say about the full-term infants. Who is full-term infants? An infant born at a gestational age between 37 and 42 completed weeks. Preterm infant, an infant that is born prior to 37 weeks of gestation. And postterm infant, an infant that is born after 42nd week of gestation. Full-term infant, preterm infant, and postterm infant. Full-term infant, an infant born at a gestational age between 37 and 42 completed weeks. Preterm infant, an infant that is born prior to 37 weeks of gestation. And postterm infant, an infant that is born after the 42nd week of gestation. So, information about the term baby, full-term baby. Functional maturity of term newborn. Weight should be more than 2.5 kg. Height more than 45 cm. Head circumference average 34-36 cm. Chest circumference 32-34 cm. The heart rate should be more than 100 per minute. Average parameters of the heart rate 120, 140 till 160 per minute. Respiratory rate should be more than 40 per minute. Cry of the neonate is vigorous. Normal newborn spends 80% of the time in sleeping, and thermoregulation is stable. Heart rate should be more than 100 per minute. Average 120, 140 till 160 per minute. Respiratory rate should be more than 40 per minute. Cry of the neonate is vigorous. Normal newborn spends 80% of the time in sleeping, and thermoregulation is stable. Please turn attention at this slide. You can compare both a newborn. One newborn baby is a term, another newborn baby is a preterm. Please turn attention, first of all, it's a different parameters of the physical development. Different weight, different height, different proportional between the head and between the trunks. The different color of the skin, different development of the subcutaneous tissue, please. It's absolutely different full-term and preterm newborn baby. Signs of a compromised newborn. First of all, the cyanosis, bradycardia, low blood pressure, depressed respiratory effort, and poor muscle tone. Cyanosis. Cyanosis is the blue color of the skin. Bradycardia is what is bradycardia? Decrease the frequency of the heart contraction, less than 100 per minute. Low blood pressure and depressed respiratory effort and a poor muscle tone. At a full-term baby, we say about the flexor posture, the spatial. Apgar scoring chart. Apgar scoring chart is a spatial scoring chart for the estimation general condition newborn baby. We estimate general condition twice. First of all, at the first minutes after birth, and the second time through the 5 minutes. Please turn attention for the estimation general condition newborns. We will use the five signs. There are heart rate, respiratory effort, muscle tone, reflex irritability, and the color of the skin. As the heart rate absence, the parameter is 0. Is the heart rate less than 100 is a 1. Is the heart rate more than 100 is a 2. Respiratory effort absence 0. Slow irregular 1. Good cry second. Muscle tone limb 0. Some flexion 1. Active motion 2. Reflex irritability, no response 0, grimace 1 and the cry second. Color pale 0, body pink, extremity blue 1, all pink, the maximum 2. Apgar scoring chart is an international scoring chart for the estimation general condition at newborn. And the doctor should estimate general condition after birth twice. First of all, first minutes after birth, and the second times through the 5 minutes after birth. Significance of Apgar score. Healthy newborn. Healthy newborn parameters 8 to 10 at birth, at first and 5 minutes. Moderately depressed newborn need reanimation 4-7 balls. Severely depressed newborn, this newborn need intensive reanimation. Significance of Apgar score 1 to 3. Neonatal period, it's a very, very important period. It is a transitional period from intrauterine life to extrauterine environment. The important characteristics of this period are intensive development of visual reflexes, the beginning of movement, development, formation of conditional reflexes, formation of visual and sensational contact with mother. It is a very important period of human life because changes in the environment during this period are very thorough. After birth, the newborn infant is getting adaptation to the condition of the extrauterine existence. Very, very important. It is a transitional period from intrauterine life to extrauterine environment. The important characteristics of this period are intensive development of visual reflexes, the beginning of the movement, development, formation of conditional reflexes, formation of visual and sensational contact with mother. It is a very important period of the human life because the changes in the environment during this period are very, very seriously for a baby. Some information about the transitory states of newborn. First of all is the first breath and the transitional hyperventilation. Next, skin is cleared from caseosa and gets reddish color with a small cyanotic shade in some hours after birth. It's a physiological newborn catarrh or physiological erythema. Next transitory states of newborn, erythema toxicum neonatorum, is very common and completely benign condition, usually arises in the first 2 days of life. It is seen in about half of healthy newborns and occurs less frequently in preterm infants. First, breath and transitional hyperventilation. Skin is cleared from caseosa and gets reddish color with a small cyanotic shade in some hours after birth, physiological newborn catarrh or physiological erythema. And erythema toxicum neonatorum is very common and completely benign condition, usually arises in the first 2 days of life. It is seen in about half of healthy newborns and occurs less frequently in preterm infants. Next examples on the transitory conditions days of newborn. Physiologic loss of weight at birth. Babies commonly lose approximately 5–7% of their body weight in the first 2–3 days after birth. This change is in weight is due to loss of water due to respiration, gastrointestinal tract. First of all, meconium is a primary stool, kidney, urination, little quantity of the mother's milk. This mother's milk, the first drop, the names colostrums, and other. Is the physiological loss of weight at birth. Babies commonly lose 5–7% of their body weight in the first 2–3 days after birth. This change in weight is due to loss of water, due to respiration, gastrointestinal tract, kidney, and little quantity of the mother's milk. Next transitory state of newborn, physiologic jaundice, hyperbilirubinemia, increase of bilirubin amount in the serum. It is observed in newborns in association with physiologic destruction of erythrocytes and bilirubin formation from the allocated hemoglobin on the basis of it. The important role is played by immaturity of the enzyme systems of liver. Physiologic jaundice or hyperbilirubinemia, increase of bilirubin amount in the serum. It is observed in newborns in associations with physiologic destruction of erythrocytes and bilirubin formation from the allocated hemoglobin on the basis of it. The important role is played by immaturity of the enzyme system of liver. Next examples on the transitory states of newborn, sex hormonal crisis. Physiological mastopathy start on the third or fourth days, maximum 5-10 days. Mastopathy is caused by sexual hormones of the mother's placenta, which are included into intrauterine blood circulation at the end of pregnancy, breast enlargement start on the third, fourth days, maximum 5-10 days. Physiological mastopathy is caused by sexual hormones of the mother's placenta, which are included in the intrauterine blood circulation at the end of pregnancy. Transitory features of the function of kidneys. Anuria. Anuria, the absence of the urinations within first 12 hours after the birth, is shown the most children. Next features, oliguria. The reduction in the amount of urine takes place in all newborns in the first 3 days of life. And uric acid infarct is the increased destruction of the cells, basically of the leukocytes, caused by the catabolic character of metabolism in a newborn. So, transitory features of the function of kidneys: anuria, the absence of urinations within 12 hours after the birth, is shown the most children. Oliguria, the reduction in the amount of urine takes place in all newborns in the first 3 days of life. And uric acid infarct. It is the increased destruction of the cells, basically of the leukocytes, caused by the catabolic character of metabolism in a newborn. The common diseases that appear in neonatal period: embryopathia, fetopathia, birth injuries, sequel of intrauterine development disorders, sequel of birth injury, immunologic maternal-fetal incompatibility, intrauterine infection diseases, acute diseases, common diseases that appear in neonatal period: embryopathia, fetopathia, birth injuries, sequel of intrauterine development disorders, sequel of birth injury, immunologic maternal-fetal incompatibility, intrauterine infection diseases, acute diseases, sepsis, meningitis, and other. And infant death rate is higher during this period. Newborn period needs proper medical observation, special care, hygienic regime, nutrition that must be adequate to their morphofunctional peculiarities. Newborn period needs proper medical observation, spatial care, hygienic regime, nutrition that must be adequate to their morphofunctional peculiarities. Next period, breastfeeding or infancy period, from 29 day to first year of life. From 28 day to the 1 year of life. The connection between an infant and its mother does not break off completely due to breastfeeding. The infancy period is the one of rapid motor, cognitive, and social development. Infancy or breastfeeding period. The connection between an infant and its mother